Gambling has reached new levels worldwide, and so has the threat it poses to global health. A new report is out. It says 450 million people have been harmed by gambling the world over.
A couple of years ago, the Ontario government legalized and licensed online gambling. And ever since, websites have been raking in billions of dollars in profits.
A quarter of Americans are expected to gamble on the March Madness games, according to the American Gaming Association. Some casually with friends, but some, they say, will place a formal bet online or in person at a shop or with a bookie.
All across Asia, people are reaching for their smartphones to enter a forbidden world: online gambling. Thousands of sites entice players with promises of easy money just a tap away.
These are some of the 31 recommendations released today with the goal of reducing harm caused by problem gambling. It proposes a 4-step plan to phase out gambling ads over the next 3 years.
I think this might sound familiar. Imagine sitting there watching your favorite sports team play, watching cable TV, watching YouTube videos, scrolling through social media, and you're inundated with online ads, but not the type of creepy online ads associated with Google listening to your conversation and trying to sell you different products. The type of online ads that are more around sports sponsorships, influencer promotions, all geared to pushing gambling as this fun and harmless form of entertainment. What you'll see is sometimes in these ads that they are advising those who are consuming those ads to know your limits, gamble responsibly. But in that type of messaging, we miss governments or public health's fight in all of this beyond individual level responsibility. Because after all, gambling, if it becomes problematic, can lead to an addiction that needs medical attention. Now, the question I want to explore for the purposes of this specific conversation is, has public health already lost the battle against gambling?
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content.
It is estimated that approximately 5.5% of women and almost 12% of men experience any risk gambling. When these researchers extrapolated the findings, they found that almost 450 adults worldwide could be affected by any risk gambling. Of this 450 million people, it's estimated that 80 million of those could be experiencing gambling disorders or problematic gambling. All right, let's take a step back here. When I was growing up in Jamaica and you'd hear about that uncle that gambled a lot, the things that would typically come to mind would be arranging a dominoes night. Dominoes is a game that they play a lot in Jamaica with friends, and sometimes money's on the line for the winners and the losers lose money. And that's sort of an informal way to gamble in a household setting. And that's something that would typically come to mind. The other thing that would come to mind is someone who occasionally played the lotto, or maybe played the lotto a little bit too much and risked losing more than they could afford to lose. And then the other more traditional form of gambling, also tied to a physical location, would be the casino. Casino being a physical place where people could go to their heart's desire and try to make as much money as possible, and more often than not, losing money during that process. Today, we exist in a much different landscape. We exist in a landscape where gambling has been transformed, and the new tools digitally that are available have expanded the reach of gambling to populations and people that it wasn't previously exposed to in this way. Now, so why am I talking about this? I came across a report from the Lancet Public Health Commission on gambling that really sparked my interest. And gambling is something that I've been thinking about for a while in terms of where it fit as a public health issue. From my experience working in public health, it's not something that was universally prioritized given the other issues that exist like substance use, mental health, food security, things of that nature. And gambling didn't always get the attention that it deserved. When looking at something like how the alcohol industry played out, alcohol is more ubiquitous now, existing in grocery stores in Canada, at the gas station. You can now have takeout or alcohol delivered from restaurants, which is a change, I believe, that happened during the COVID-19 pandemic that was maintained beyond that. And then it made me think, have we now lost the gambling battle in the way that we've lost the battle against alcohol? You might disagree with me, but I feel like in the alcohol space, at least in Ontario, Canada, and many other jurisdictions, there's not much more advocacy that's left to be done to limit and control the exposure to alcohol and the use of alcohol to our public health populations. Now, going back to the topic of gambling, globally, it's estimated that just over 46% of adults and 18% of adolescents gambled in the past year. Now, not all gambling is harmful. Some people are able to have a healthy boundary where they limit their bets and it doesn't consume their everyday life. But other people, whether you enter the gambling spectrum from the minimum risk side of things, or you enter to the risky side of gambling and then progressing to problematic gambling or having a diagnosed gambling addiction, there's spectrums to this just like there are for any other addiction. The difference between gambling and other types of addiction is that it's a behavioral addiction more so than an addiction to a substance or product. So gambling exists in this tricky area, and while there's been a lot of work to study the harms of gambling over time, we don't know as much about gambling and the long-term effects of the population, especially with new ways to enter gambling, new ways through which the industry attracts gamblers or people who might go on to become problematic gambling. That body of knowledge is not as developed as something like opioids or alcohol, for example. One of the challenges here is that governments are lagging behind. I always ask the question that governments are expected to do so much. And after all, we have our elected officials, and they're elected and put in office to have the collective interests of many people. But how could they possibly keep up with a dynamic, fast-paced private industry that invents a new product or reinvents a product or invents or reinvents a new way of distributing that product or service in a way that outpaces how a government might keep up with those innovations and be able to control it before it becomes problematic? That's something that we really have to think about. Private industry versus the government for innovation. I would say private industries win many of those cases unless the government, for example, is able to allocate resources in being able to anticipate emerging public health threats and proactively develop policies to prevent things from slipping through the cracks, because once something gets out of the bag, thinking about vaping, for example, it's really hard to put that back in the bag without drastic changes to regulation. And when the industries like the tobacco industry, the alcohol industry have such a huge influence over government through lobbying, it's really hard to take and walk everything back to a point where it never existed in the first place. But is it realistic to be proactive when more resources exist in the private sector to innovate in this way? In terms of the private sector and innovation is also facilitated by the technological infrastructure that now exists. And talking about the internet, talking about mobile devices, talking about all these different platforms and apps that allow for gambling to take place relatively easy and very accessible in ways that weren't conceivable before, right? Like I said, you're talking about lottery tickets, casinos, scratch tickets, and now you have an app on your phone where you can gamble. Now you have sports betting. And I want to point something out, because when I was reading this, things all started to make a little bit more sense. And what I'm referring to here is something very important happened in 2018. That important thing was that the Supreme Court in the US reversed an existing federal ban that prevented sports betting. That decision allowed states to then legalize sports betting. And with the boom of the internet and with the boom of online technology, there was a massive expansion of gambling and how accessible it was in the United States. While many other countries might not have had the same process of a federal court overruling a ban that allowed for sports betting to be a reality, the idea still holds that the technology existed in such a way, or exists in such a way, that sports betting, for example, is as easy as making a couple clicks on your phone, where previously you had to go to great lengths to make a bet. For example, I was watching a YouTube video, and this person was talking about when he would bet on horse racing back in the day, he'd have to get a certified check, mail it to them. They'd have to 7-day waiting period to determine if they're going to approve it or not. They'd write a letter back to let them know that was approved. Look how far we've come, where within seconds you can place a bet and lose money, right? So the impact or the instant gratification or the instant disgratification, if that's even a word, or the instant harm can be felt. And that's why gambling is now getting that level of attention. Many public health professionals, many public health experts were sounding the alarm previously. And now we're in a stage where I can probably list 6, 7, 8 betting apps. Not because I use them, I don't do any betting, but because it's so integrated in the advertisements for a basketball game, for example. In a basketball game, there's banners that advertise the betting companies. There are segments on the broadcast that shout out the advertising companies. There's apparel that players might wear that advertise the betting companies. So it's so in your face now. And the challenge and the danger here is the exposure to the younger population. Younger population, of course, if restrictions are in place to prevent betting. A lot of experts would like to see the age restriction be 25. However, that age restriction being set to 25 doesn't prevent someone, an innocent 16-year-old who's watching their favorite basketball game, it doesn't prevent them from seeing the ad on TV, right? So through this repeated exposure, we're being wired to normalize betting, and especially sports betting, which is now so prevalent. Okay, so what I've shared so far is a mixture of evidence from the report that I read, as well as my own reflections and opinions. It's as equally as important to introduce or bring facts into this conversation, while also admitting or pointing out where further research is needed or more information is needed, particularly for this question. So there's a lot of concern, and rightly so, that there is factually more marketing and advertising and exposure to gambling services, products, or sports betting services or products. Has this repeated exposure, more frequent exposure, and then the volume of the level of exposure, has this actually led to higher rates of problematic gambling? Okay, so I'm going to repeat that question again. Do we know if this boom in the gambling industry has resulted in more people being addicted to gambling at the moment? I don't have an answer to this question. If you do, let me know. I cannot find anything that is conclusive on that question. In many jurisdictions, it would seem that gambling rates had either plateaued or were decreasing prior to the overturning of the gambling ban or the sports bet ban at the federal level, which the Supreme Court reversed that ban in 2018. But as much as I ask this question, the answer to the question could be no right now, and it could be yes in the future. Right? The answer to that question could be to be determined. And even if there are no significant increases in the rates of gambling so far, it doesn't mean that this is not something that's bubbling below the surface. What happens when that 16-year-old who has seen the ad repeatedly for 3 years, for 8 years, when they're now legally able to participate in gambling, how will it affect them? And that's the thing about public health. You're unable to do these randomized controlled trials in a lot of instances, and your data largely comes from things playing out and then making conclusions after. So we really won't know until we know the true extent of this damage that everybody's so concerned about. All right, in this paper, they talked about some proposed actions as a way to completely ban gambling or to control or keep gambling under wraps. So some of what's been thrown out there include restricting gambling ads, which I think will be very difficult given how integrated gambling is now with sports. And gambling companies have paid media and sports industries lots of money, probably billions of dollars. And that one is probably virtually impossible to put back in the bag. Sports sponsorships, you would have to get buy-in from, for example, if you want teams in a certain sport not to accept sports sponsorships, it would then rely on the league to set those rules in place, and the league themselves are also benefiting from money coming from gambling and sports bet companies. So that one, I think, also seems a bit unlikely. Now, the ones that are more realistic, I would say, are the bet limits. So I am aware that many apps have bet limits and allow a user to set bet limits that work best for their situation. and the app will essentially block the person from making further bets if they exceeded or reached the threshold that they indicated on there. And that could be like in a given moment stop someone from making a decision that they might regret later, but perhaps not a long-term fix. The other one is increasing public awareness campaigns. This one's a bit of a mixed bag because the public awareness campaigns that I see are about gambling responsibly, knowing your limits, understanding the harms of gambling. And they really place the level of responsibility on the individual and not so much the industry or the regulators. So again, how significant of an impact public awareness campaigns might have in the long term, not sure if I'm completely sold on that. So as we start to talk through some of these solutions and you hear my skepticism around some of them, it brings me back to the question that I opened the show with. Have we already lost this battle? Have things already gone too far? With gambling being a part of media, the digital space, culture, and society itself, that the measures that we will deploy at this point, or the potential measures that could be deployed, will largely be ineffective or will be overwhelmed by additional measures the gambling industry might take to account for these changes. Are we already too late? Again, I don't mean to sound very pessimistic, but the situation that we're in with gambling is very reminiscent of alcohol, of vaping, and you're seeing in real time the true difficulty that public health is now having with those. Is there anything that we could do to address problem gambling? Should it be banned entirely, or should we more be concerned with the rates of problem gambling specifically versus those who gamble occasionally? I'm not quite sure. I'm not sure what the answer is. I'm not sure. Anyways, if you have something to say as you're listening to this episode, I encourage you to leave a comment. So if you're listening on Spotify, once the episode is published, you'll be able to comment directly on the episode. We'll get a notification and we can engage with you in the comment section there. Another way to reach out to us is through the feature in the show notes or the description of this particular podcast episode. There will be a link at the very, very, very bottom that allows you to actually send a text message to us that we're able to read. And because we're not able to respond back directly because of how the system works, we would address that comment and give you a shout out in an upcoming episode and acknowledge your contributions to this very meaningful discussion that we're now having. This has been Gordon, your host for this episode, signing off. Until next time. Peace.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.